Ya, Assalamualaikum. And very good day to Madam Asma. I am Nurul Zalikha binti Mahir with the student ID 4201000561. I am doing this. I am doing my clinical internship at Hospital Tanjung Karang. Okay. First of all, my abstract is about a 50-year-old woman with para 5+1 history who has been married for 25 years and has had 3 doses of vaccination already, and also has been hospitalized twice for COVID infection and had all 5 childbirth via spontaneous vaginal delivery. The patient has a history of menarche at 13 years old, and she had a regular menses within 6 to 7 days. The patient has a history of upper respiratory tract infection (URTI) and has been given tranexamic acid. The physician concluded that the patient is having symptomatic anemia due to prolonged menstrual bleeding and also other causes. This tranexamic acid is a kind of meds that is act as antifibrinolytic medication which helps to stabilize the blood clots and prevent their from breakdown. Okay. For my case report, it is about the uterine leiomyoma, which is known as UL. It is the most frequent benign tumor of female genital tract. Even though many women with uterine fibroid don't have any sign or problems, it is considered as should be concerned. If a woman has fibroid that cause her to have a heavy period, so it could lead to development of iron deficiency anemia over time if it is prolonged. And also, the complication from uterine fibroid are rare, but some of them could be very serious. So it can be concluded it is important for women with uterine fibroid to talk to their doctor about their disease and figure out their best way to resolve it. So in my case, it is about a 50 years old lady which already with para 5+1 and had history at Laboratory of Cancer Biology in 2004. She had married for 25 years and she already had 3 doses of vaccination. Her first hospitalization is in 1996, which is due to the history of miscarriage. And also the patient had a history of COVID infection twice, which is on May 2021 and also March 2022. Latest, the patient visited the private general practitioner on Wednesday, which is due to upper respiratory tract infection (URTI). And there, the full blood count (FBC) was taken, and it shows the result with low hemoglobin reading, which is 4.7 gram per deciliter. The case was presented where she is having a heavy menses with the blood clots where she used the diapers from day 1 to day 3 since June 2021. Later, the minimal staining post heavy menstrual bleeding every month since then. The patient also frequently having headache since April, which is on and off. Next, uh, it was also noted that she had no experience of SOB, where the lung shows a clear and equal air entry. However, during her presence at ED, her blood pressure (BP) noted with 148/67 with the pulse rate reading is 101, which is quite high. So the impression from the investigations, it indicates that the patient is having a symptomatic anemia secondary to prolonged menses, TRO other cause. Other than that, it is also detected that the patient is having URTI. Then the patient was given tablet paracetamol PCM 1 gram stat. And then she was asked to rest for a bit, and the scanning at the bedside was done. However, the patient is on examination and observed as alert, conscious, not tachypneic, good pulse volume, and also warm peripheries. After repeating of blood pressure, the result obtained is 130/64, which is much better. With the pulse rate 76 compared with previous is 101. The SpO2 reading is 99% under room air. The temperature is 37. It is quiet, just a bit high compared to the normal temperature. With the pen score 0, the lung clear, and also the posterior is examined as soft, non-tender, uterus are not palpable, no mass palpable, and it also noted that is no bilateral cuff tenderness with the pad minimally stained. So the impression noted by the physician is prolonged menses secondary TRO causes. So it might be due to the premenopausal bleeding. So this is kind of normal for uh, this category of people. So the physician has decided on a few plans which are to off the MPO2, and then the physician also plan to complete the current pine packed cell transfusion and also KIV for another pine packed cell transfusion later. And then after the transfusion, of course, the physician need to monitor the patient first by repeating the full blood count 6 hours post completion transfusion. And then the intravenous tranexamic acid also given. The transabdominal ultrasound and transvaginal ultrasound also planned to be taken after completing the transfusion. Lastly, the pap smear was taken on 26 May 2023. So for the discussion, for this case, it is considered as a rare case where the submucous leiomyomas can cause severe complication. That may pose a risk to a person's health. If a patient is not suited with those minimal invasive procedure, then the patient has to undergo the surgery options. And lastly, the meds, tranexamic acid, usually it is used and will be administered orally or intravenously or topically, depend on the specific situation, and depends on the healthcare provider's recommendations. So as a conclusion, submucous leiomyoma can cause infertility, pregnancy complication, and also anemia if it is left untreated, which means we are not concerned about this case. So it is kind of danger and should be alarmed. Then the treatment option, which include medications, minimal invasive procedure, and surgical intervention, are the options that can be given to the patients, which can help the patient to get better. However, if a patient is not suitable for this procedure, there is last option, which is surgical intervention that may be necessary to help them uh, to recover and live like the normal normal people. And the medication which is provided by the pharmacist is usually tranexamic acid, which will be prescribed for women with heavy menstrual bleeding. Usually it will be prescribed by the physician. Okay, that's all for my case study. Thank you. Assalamualaikum.